The Indonesian Doctors Association says it's premature to say Jakarta has flattened the infection curve. That runs contrary to claims made by the government's COVID-19 task force. New numbers reveal deaths in the country could be underreported. Reuters data from 16 of the country's 34 provinces shows more than 2,200 people died with acute COVID-19 symptoms, but they were not previously recorded as having this disease. Instead, the cases are classified as patients under surveillance, also known as PDPs. The central government's national death toll of 773 does not include these figures. That number is likely to be higher. Our correspondent Saifulbahri Ismail has the very latest.
Health experts also agree that the COVID-19 death toll in Indonesia could be much higher than what is being reported by the central government. The health ministry said as of Tuesday, there are more than 20,400 suspected COVID-19 patients. However, it did not disclose how many of the suspected COVID-19 patients have died, but some regional governments do. Now, that Reuters report, which estimated more than 2,200 suspected COVID-19 patients that have died. For example, the East Java provincial government recorded 288 suspected COVID-19 patients have died. The Central Java provincial government recorded 251 suspected COVID-19 patients have died. Now, the government in Jakarta, which is the epicenter of the outbreak in Indonesia, does not provide such data, but has disclosed more than 1,000 people had been buried according to COVID-19 protocols. Now, suspected COVID-19 patients, or PDP, are not yet confirmed as having the disease, meaning they are waiting either to be tested or for their test results to come back. Patients are classified as PDP if they have acute respiratory illnesses for which there's no clinical explanation other than the new coronavirus. Health experts said suspected COVID-19 patients who died might have tested positive for the coronavirus. Therefore, it's important for authorities to disclose how many of suspected COVID-19 patients who died had been tested and later turned out to be positive. However, epidemiologists also warned of overestimation because not 100% of the fatalities may be due to COVID-19.